I'd now like to introduce our final guests, Gina Delaney and David Dwyer. Gina Delaney works with the Mental Health Ireland as a development officer and brings a range of experience, including community development, mental health and well-being coaching, and family recovery. And David is a peer educator for the South East Recovery College and played a key role for the delivery of this program. Gina and David are going to share with you their findings on the program and run in a CHO5 called Building Skills for Engagement and Recovery. So welcome.
Great, thank you. Thanks, everyone. Are we good on the clicker? We can work away on our own. Brilliant. Okay, so I suppose just to acknowledge that everybody's probably tired and feeling a little bit heavy, maybe, after all the discussion that we had after eating our lovely lunch. And so I suppose if you need to get up and walk around, I'm quite happy. Claire, David, are you happy for people to walk around and do what they need to do for themselves? Perfect, great. So thanks for your patience as well. So I'm Gina, and this is David, and this is Claire, and we'll all introduce ourselves when we get to it. But it's definitely going to be a whistle-stop tour around building skills for engagement and recovery. But it's a mental health engagement and recovery initiative supported by Mental Health Ireland. So you can definitely find out more through mental health engagement and recovery. I suppose we're just here to tell you about what it was like for us when we delivered it in our area. This is a national programme that was developed, as we said, it was led by Mental Health Engagement and Recovery, supported by Mental Health Ireland, came together, I think it was 2018-19, and it was a co-production process where people who were members of forums, recovery education facilitators, area leads, loads of people, I suppose, involved in developing this training that runs over, I suppose, a number of modules. So we decided to deliver down in our area. We, I suppose, felt that we had the people to work together through Claire in the Recovery College, David as the peer educator, Paul was the area lead, and myself as a development officer in Mental Health Ireland. So we came together then to deliver it. I suppose it met the organisational commitment for the local services to be able to support the forums, and it was requested through the forums as well to have additional, I suppose, skills and knowledge around participating effectively in mental health engagement recovery through the forums in particular. So we're going to tell you about some of the evaluation results, but just maybe to tell you about, I suppose, personally why we were interested in it. I joined the forum, I think it was around 2012, and my mother was accessing services, and we were going through a difficult time, weren't too sure what to do about the difficulties that we were having with the services at the time, and somebody said, sure, go along to the forum. What's the forum? Didn't know. So go along, and we met some very good people, some of the members down here, and we just, I suppose, were supported to find out a little bit more about our particular situation, pointed in the right direction of how to deal with it, and then invited to get involved and help to make a difference then. So that was very good for me, and just kind of fond memories, I suppose, of going together to meetings, myself and my mother, and you know, it was lovely, I suppose, feeling that our voices were heard and we could make a change. David and Claire, would you like to share a little bit about your personal motivations? Yeah,
thanks, Gina. I suppose I'm David, and I'm peer educator with the Recovery College South East, and I'm just working in the services relatively short compared to the two lads, just the 3 years, but you know, I came through and lived the experience of addiction, chronic addiction and mental health challenges all throughout my life. There were some mental health challenges in my family as well. And, you know, my eyes have really been open since I started working in mental health services. I didn't know any of this existed, this kind of engagement and recovery. And I know there's lots of areas probably for improvement and everything, but it's great that we can all meet here today. And when we started this, we didn't really think that we'd be presenting it here today. In terms of the forums themselves, you know, like any kind of new job you start, you hear different things as time goes on, you realise what's important, and kind of things take on different significance. And the forums are something that I heard a lot about. And when people spoke about the forums, they actually spoke about them, you know, with real passion and love and from their heart. And I really got a sense that these forums meant a lot. But not only that they meant a lot, but they had a lot of potential. And I know maybe they're not working as they ought to be, but the idea of it itself is a powerful one. So I was delighted actually to be invited into this training as well. So that's my kind of narrative on that.
Hi, I'm Claire. I'm the recovery coordinator for CHO5, and I suppose I became involved first in consumer panels in around 2012 or 13, and I really believe that the pathway for change is through engagement with people who access services and also family members, and I see the forums as being the next step from the consumer panels. And as part of the Recovery College and delivery of recovery education within our services, I suppose I do see the recovery education service as being maybe part of that driving force to co-produce and develop training around engagement and, how do we really get people involved in our services, in service development. And yeah, that's it. I'm a nurse. I've been a nurse for 30 years, and so yeah, I'm still here. Okay, thanks.
Thank you. There you go.
So just in terms of then who was involved from day one with the training, and it was all done in the context of co-production, of course. The core team then were Mental Health Ireland, so Gina as a development officer, the Recovery College, myself and Claire, Claire being the coordinator, myself as a peer educator, and Paul Fallon then the area lead for Community Healthcare South East. But we didn't work alone, obviously, and there was a kind of a wider team. So our recovery education facilitators were an integral part, actually, of the success of running it out. They became involved on a weekly basis. They sat into the whole lot of the training. They were able to help out with facilitating breakout rooms and, generating discussion within the sessions as well. Some of the facilitators were existing members of the forums, and the rest of the group was made up with 4 members as well, who also brought a vast amount of experience to people who maybe all this was new to as well. I see Millie there. She needs a mention there because she brought her wealth of experience to us, and she really helped people along during the training. And then just outside of that and beyond, so as I said then, the current and new 4 members. And I suppose I would see myself as a newish 4 member because it was this thing I had heard of, but I hadn't actually participated up until then. And I really felt motivated after this, and I'm on board now with the forums, getting involved more. So that was kind of the effect it had on me. So it was done in co-production and in true partnership. We reviewed, we delivered all as a team. So we had all the different perspectives there, the lived, the family and provider. And we were lucky enough as well to have guest speakers from service management. And I see Siobhan Turner there, the general manager of the area, and of course Michael Ryan came in. And that was really beneficial. And actually it made people, it kind of just gave that extra meaning to the forum and to the training as well. And people were delighted with that, because it made that connection between the ground and the kind of service management areas. And it wasn't just tokenistic either, because the conversations were meaningful, and they stayed around, and there was a discussion, a question and answer session as well. So it was really powerful as well. And all in the name of planning, delivery and evaluation. And I suppose in some ways we're here today to evaluate it with you all as well. So I think, Gina.
Thanks, David. So this, just to give you a little overview of what it was about. So this is how we advertised it. So, the dates of when it was on, and just some of the topics that people could expect to have discussed, like having lived experience and people's roles, self-care, leadership, change management, group facilitation skills, just some of the core, I suppose, content of it. It was delivered online then and over 6 weeks, and the times there, and people could book then through the Recovery College South East. So that was really good, because I think it kind of streamlined, the fact that this is education. Some of the, just kind of whistle-stop tour really. So week 1, an introduction to volunteering. We said it was important just to kind of set the scene around, volunteering. Introductions, to facilitators, to each other, to the content, what it's all about. Effective meetings then in week 3, and like you're just seeing one little kind of line going across, but like obviously a huge amount within each week. So just was, how do you effectively participate in a meeting and effectively hold a meeting? Leadership and change management, I suppose that's what it's all about, isn't it? We're engaging to, I suppose, have positive developments within our service. Week 5 then, roles and responsibilities. So, you know, how, I suppose, do you effectively participate again through the different roles that are available and how that works. And then the final one then was around group facilitation. One of our recommendations was actually that when it was designed, I suppose at the time it was agreed that maybe just people who were going to be chairs or co-chairs would take part in that week. But we actually felt that for, I suppose, sustainability and ongoing support, that it would be better if everybody took part, and everybody wanted to take part, which was good. The overall aim then, so to develop skills and knowledge for mental health forum members to participate more effectively in forum meetings. One of our recommendations, again, having gone through the delivering the training, was that we felt that that aim was a little bit too narrow, that actually overall it was, you know, around enhancing engagement, like, you know, and that it really provided a lot more skills for people to do that. So I suppose to theme the objectives, that it's around building skills for leadership, management and participation, increase knowledge of engagement and recovery, build skills for effective meetings and facilitation, and increase knowledge of roles and responsibilities and volunteering as well. So like quite a lot within it. Thoroughly enjoyable, just to say as well. And David will tell you a little bit more then about the feedback as well. So. Don't look surprised, like you think that.
I thought you were doing the quotes.
Oh, maybe I was I? Okay. Oh, yeah, you're right, I was. Yeah, okay. All right, you press the button then.
There you go. Can you see it?
No, that's very small, isn't it?
Look, it's here.
Okay, so these are what some people said. So, you know, I suppose, like how do you measure how effective something was in getting the feedback? So I suppose you have qualitative and quantitative. You could have stayed with me when you were there. I felt better when you were beside me. So what they said was beneficial. The beneficial parts of the training, like so small group work, you know, that you could kind of have the chats, like, and mixed method of delivery. Then, like, so having the slides, having lived experience, you know, so just hearing from other people, the breakout rooms, shared learning, and the guest speakers from service providers. So it came out very heavily, very quickly, that actually having people who had participated in the forums as, you know, active participants was very helpful throughout the process. Supported to bring up issues that are important to you. So I suppose for some of the newer participants, people newer to forums, this was like a forum for them, because it was bringing up different things maybe that they hadn't discussed already through the discussions. Family can benefit, the shared journey to and from the meetings that are important to you. So, you know, I suppose just having those opportunities to talk about things that you don't ordinarily get. You get to know what's happening, and fresh perspectives, sustainability through participation. So healing, while it's not actually a therapeutic space, it can be healing through identifying with others. Getting an understanding of various perspectives. So community, yeah, so just the voice is powerful. Chime then, so individual level, strong sense of meaning and purpose from participating in forums. So people felt that it kind of met that for them. Ownership of my place at the table. So something important to say, and feeling like you have a place and a space at the table. Bridget Walsh, that came out, yeah. So if anybody knows Bridget Walsh, she's actually Paul's admin support. So the area leads admin support. And she actually played such a vital role that she came up in, you know, what was really good about it. Like, so yeah, she's worth a mention here today as well.
Thanks.
Sometimes that role is very underestimated, isn't it?
Yeah, she was very much appreciated anyway, wasn't she? So it was this slide will be very busy by the time we're finished with it, but it's just a couple of stats, and it was a very small group, I suppose, in terms of stats, you know, and it wasn't a kind of a study or anything, but certainly give us a sense of how people experienced it and how satisfied they were with it. So we conducted a survey at the midway point after week 3 and also after week 6. And so you can see there yourselves, 100% felt they could participate, participate better, I suppose, in forums. And that was one of the aims, is to increase capacity of the forums and the people in it, to make it a productive space, I suppose. 77% felt that they had a better understanding of the forums. And I didn't complete the survey, but I'd certainly be one of those on that side. 100% felt the training was high quality, and 92% were satisfied with the training, the length and duration. Now that does come up in one of the recommendations around the time and when it was ran out. It suited us to run it out on a Thursday morning, but that's something that might be looked at if it was going to be rolled out nationally or in a different area. So a couple of just some more statistics there. 77% would like to take on an additional role, so probably an existing member of the forum, but now after doing the training, maybe having the additional confidence to advance into another role or take on a different role. 100% said the training suited their needs. And just a mixed response, I suppose, around the online as opposed face-to-face. So 25% would prefer it to be in person if they were to do it again. 25% online, and then 41% had no preference. 25% preferred a blended approach. So I suppose room to manoeuvre there, and room for choice as well in terms of delivering it out again. So there was a whole range of recommendations that we made actually after the completion of writing up the report. These have been sent on to Mental Health Engagement and Recovery, and they're probably available if you want to see them. But there's a whole range of recommendations, but largely the themes that they came out in were around the times and the duration of the training, the attendance and participation. So the service managers was a huge thing as well for people. That was really highlighted in the feedback, and that really worked well. The facilitation, delivery, so holding on to the recovery education approach, I suppose. Small group work, open discussion, breakout rooms, adult learning principles, and program resources. So something else that came out was people had asked for maybe the development of a booklet to accompany the training, so it gives people an insight into the training, but also afterwards kind of a resource or something to refer to going forward, so they could stay participating in the forums and be active in it as well. And then the program content. So some of the slides we felt maybe were too detailed or not detailed enough, and we as a team reviewed them and made a co-productive decision on some of them. And then there was a number of other recommendations. You'll see them all in the report if you want to see them. I suppose just an example of the other recommendations would be, we thought maybe the development of a package for HSE land training around forums. So I'm going to hand you over to Claire now, who's going to elaborate a little on the recommendations.
Okay, just some of the key recommendations, I suppose, which was mentioned already. Module 6, to be attended by all members, not just chairs and secretaries, which was a facilitation skills module. But as you saw from the feedback there, that the majority of people really enjoyed this module and felt it should be included in the whole training for different roles that people would be getting involved in services. Shorten the sessions. I suppose this to 6 weeks was quite a big commitment, even though the content was very relevant. And I suppose the presence of service providers within the training, and trying to find a way of maybe encouraging service providers to get involved. I mean, it's a huge challenge within services, and perhaps maybe even have a specific session for sort of service providers to become involved with the training. I suppose I would see the presence of service providers in the forum training and as part of forums as really essential for that change to take place within services. So it's a big challenge for services. Review the overall aim. I suppose the overall aim was really, looking at engaging people and giving people the skills for engagement in committees and in forums. But really, I suppose when we reflected and after the training, we thought, the discussions within the training was around, service development, and people are getting involved in, whole service development. So it's more than about being involved in forums. David had mentioned around the guest speakers to open each session, that was extremely beneficial, and it really did connect, I suppose, the participants of the training to, I suppose, the commitment of the organisation to the development of forums within services, and the feedback showed that as well. And especially within that, there was a question and answer sessions, which proved very effective. Explore further what is required to support forum development. So I suppose that is, how do we put this on the agenda? How do we get, forums well known, that people are very much aware that they have, they can attend forums and what they're about, and getting involved in forums, not just in the training, but what do they do with the training then afterwards, and how they can really become involved. Having a variety of perspectives and experiences from participants taking part enhances, I suppose, the whole experience for everybody. And we did, although we did have a variety of experiences and perspectives, we did have, within that particular training, I suppose the lack of service providers, I suppose it did take away too from some of the experiences for both sides. And I think that's really is, very essential and vital for the success going forward with service development. Okay, I think that's it. And I suppose from our own experiences, it was a training that was co-produced from start to finish. It was robust, and I'd like to acknowledge Paul Fallon, who's actually not here today, the area lead, who was involved in the development and the co-delivery of the training as well. So thank you very much.